Hello, I am Pam Cipriano, President of the International Council of Nurses. Hello to all my colleagues in Kazakhstan. I bring you greetings from the International Council of Nurses, Board of Directors, our staff, and our more than 130 National Nursing Association members, representing the voice of more than 27 million nurses worldwide. As you come together to honor International Nurses Day and advocate for the investments in nursing that will continue to advance education, research, and practice. ICN's mission is to represent nursing worldwide, to advance the profession, and influence health policy. Our goal is to raise the voice of nursing, to lead, to inspire others to take on the challenges, and to inform colleagues, governments, and the public how to make the most of nursing knowledge and a workforce that is critical to any nation's health and the health of its people. International Nurses Day is a unique opportunity to celebrate the incredible acts and impacts of nurses on the health of our nations and the world. These stories aren't limited to one day, but resonate throughout the year. It has never been more apparent how vital our work is to the lives and livelihoods of the people and communities we serve. The theme for the 2022 International Nurses Day, celebrated officially on May 12th, the anniversary of Florence Nightingale's birthday, has been Nurses, a Voice to Lead, Invest in Nursing and Respect Rights to Secure Global Health. This call for action reflects the urgency to strengthen the nursing workforce so that we can deliver on goals of universal health coverage. The workforce is aging, and with heavy workloads and sustained pandemic trauma, is hemorrhaging experienced and novice nurses alike. We cannot wait to improve our work environments and increase support for professional development of nurses. ICN has been vocal in its call for investment in the nursing workforce to meet healthcare needs now and into the future. We are joined in this call for action in collaboration with many colleagues, specifically the World Health Organization. WHO's first State of the World's Nursing Report, released in 2020, identified important gaps in the nursing workforce and priority areas for investment in nursing education, jobs, and leadership to strengthen nursing around the world and improve health for all. This was followed by the 2021 report from WHO on Global Strategic Directions for Nursing and Midwifery 2021 to 2025. Which presents evidence-based practices and a set of policy priorities that can help countries to ensure that midwives and nurses optimally contribute to achieving health equity and universal health coverage. These policy priorities focus on education, jobs, service delivery, and leadership. Earlier this year, ICN, together with the International Center on Nurse Migration of CGFNS and WHO, published another critical report titled Sustain and Retain in 2022 and Beyond, the Global Nursing Workforce and the COVID-19 Pandemic, which identified clear actions needed to implement the directions and policy priorities of both the Strategic Directions for Nursing and Midwifery and the State of the World's Nursing Report. It is also responsive to the emerging crisis caused by the significant attrition from the workforce and calls for investments to guide workforce planning to stem the global nursing workforce shortage. Achieving all of these investments will not be done by nursing alone. It will rely on collaboration and support from many stakeholders who understand that without nurses and nursing care, there cannot be health. What can you do to urge your leaders to invest in the strategic priority areas of nursing? I offer a few examples that support all four areas of education, jobs, leadership, and service delivery. First, build on the work you are discussing here today, developing your higher education system and assist members to pursue further education. Work with government leaders to increase investments in education by making sure they understand that nurses improve health system and patient outcomes and advocate for graduate levels of education for advanced practice nurse roles. Ensure the quality standards of practice match the education, scope of practice, and competencies. Develop leadership capacity by mentoring emerging nurse leaders, acquiring key skills in the areas of finance, regulation, and policy development to position yourself to lead, and expand research and evidence to support the business cases for nurses working to the full scope of practice and education. ICN has also prioritized two policy areas for investment: the safety of nurses and healthcare workers and their health and well-being. ICN stands with all the world's nurses, and as always, have been lobbying for your safety, working to eliminate violence against healthcare workers, and making the case for greater investment in nursing, jobs, leadership, and education. Our work directly influences global health agendas. We know we cannot have health for all without a strong, resilient health workforce. Now more than ever before, we see the unnecessary gaps in keeping nurses safe, either due to inadequate staffing or supplies, or unchecked violence at work and in our communities. And the prolonged stress, fatigue, and moral injury of the pandemic have also amplified the threats to well-being for nurses everywhere. We must protect our nurses and other healthcare workers. Health workers' rights are human rights, and those rights are now both at risk. Nurses have the right to work in a safe environment, free from abuse and violence. They have the right to have access to vaccines and personal protective equipment, the right to adequate and equitable pay and mental health support. ICN supports nurses' rights and calls on governments to fulfill their obligations to respect and protect human rights, and to adapt and uphold legislation to ensure equal access to healthcare, vaccines, and protection, not only within their own countries, but worldwide. We want to see a world where human rights are respected and protected, so we work in partnership to advance the profession and seek to improve the well-being of nurses and all health and care workers. We work together to advocate for workplace health and safety through better education, policies, and procedures that protect workers, research on best practices, and availability of known preventive measures. We work to ensure positive team environments and workplace cultures that provide support to others, as well as maintain our own health and well-being. These are now the mainstay of our work together to have and retain a healthy workforce, no matter where nurses practice. My presidential watchword is influence. It is a power we can leverage to advocate for the needs of nurses, as well as those we serve, and convince others to recognize the impact that nurses have on our patients, families, and communities. All of the actions to secure investments in nursing require us to influence others, those who already support us, and those who are in a position to lend financial, political, and intellectual support to our global agenda. ICN supports you in raising influence at every level, including with the highest leaders in government. Thank you for your dedication, hard work, and sacrifices throughout the pandemic. You have persevered in difficult circumstances, sometimes at great personal risk. You have shown the world why a strong and supported nursing workforce is critical for health. Together, as we look to the future, we will build a more responsive health system that addresses global health and improves the health and well-being of all people, with a commitment to invest in nursing. Your work to modernize higher education practices will be an important contribution to the global health agenda. Our educational systems form the foundation for learning, setting quality standards and competencies, and pursuing the research that brings forward the evidence to build our practice and provide higher levels of care. I wish you a successful meeting that lifts spirits and restores joy and meaning as you continue to lead and advance the profession to promote health and health equity for all.